Dr. Bob is the name, emergency medicine is the game. Welcome to my world, emergency medicine. I'm a practicing ER physician and I'm going to tell you things about the ER that you need to know. First thing is, when I was training in medicine, I trained as an internal medicine specialist. That's a doctor who takes care of everything inside but has no specialty. What they don't tell you in internal medicine is that when you train, you go to a thing called the internal medicine clinic. In that clinic, you see patient after patient after patient with incurable disease who are non-compliant and who have a bad prognosis, one after the other. You see them for 15 minutes. It's kind of like putting bandages on a bleeding artery. It just doesn't work. So I got bored with that. I have ADHD, so it's hard for me just to sit there and see patient after patient after patient writing prescriptions. The only good thing about it are the patients themselves. And I do remember one patient named Emma. And Emma was probably 92 years old or so, and she would come in to see me about once a week. She had a little osteoporosis, a little hypertension, nothing really bad, and I would see her once a week because she was delightful. She would come in with her gloves on, her hat on, her parasol, all dressed to the hilt, her pantyhose on, and her girdle on. And we'd sit there and talk for about 15 minutes, and I'd renew some of her medicines, and then at the very end, after it had taken us about 30 minutes to get her undressed, I would go in and examine her, because examination would be part of the ritual. I would listen to her lungs, listen to her heart, all of which were normal. And then I would help get her dressed again and help get her girdle back on and help everything back together again. And once I got her finally going out the door, she'd be leaving out the door and she would turn around and she would say something like, "Does it mean anything that there's blood in your stool, doctor?" And I would tell her, no, it doesn't. We're going to give you some little cards, and you can take these cards home and get some samples and come back. The one thing I remember most distinctly that she told me one time was, she said, "You know, doctor, I'm almost completely legally blind. I can't even hear anything with my hearing aids. I'm practically deaf. I can barely walk with my walker. Thank God I can still drive." And that's a true story. You don't see her driving around because she only drives around at night, and her head's below the dashboard most of the time. Anyway, after being in internal medicine for a while, I decided emergency medicine was the only way to go. And so I started working in a large emergency room. I call the emergency room the trailway station of medicine. There's something there for everybody. The current emergency rooms, like the one I work in Southern California, are being overwhelmed by tsunamis of baby boomers who are sick, sick, sick. They come with walkers, they come in wheelchairs, they come on gurneys, they come with oxygen. It looks like lords that they're coming to be cured. I'm not going to be the guy to do that, but that's how they come in the ER. And the average age of most of these patients when they get in there is deceased. They're that old. I have a rule that when they roll into my ER, the nurse has to go up to their face with a mirror and put it in front of their face, and if they don't fog the mirror, they can't come in. The other day I was coming to work, I had on my scrubs, and coming through the front door there, the ambulance entrance, there's a man lying in the hall, and he's moaning and groaning, and he says, "Somebody's got to help me. Somebody got to help me." And as I was going by, he saw me, and he said, "Are you the doctor?" And I looked down at my name tag, and I said, "Well, yes, I am." And he said, "Well, I've been here, and I'm in pain, and somebody got to wait on me." And I said, "Just a minute, sir. Concierge. Who can come to the emergency room? The only requirement for coming to an emergency room in the United States of America is being a Homo sapien. Homo sapien, that's the only requirement. You don't have to be a citizen. You don't have to have insurance. You don't have to like me. In fact, you can spit on me, call me names, insult my family, and bite me, and still sue me, as a matter of fact. So anyone can come to the emergency room. They asked President Bush, and you can see this on tape on YouTube, they asked President Bush about why America, with all of our industrialized and state-of-the-art medicine, doesn't have free medical care for everyone. And his answer was, "What do you mean? There's free care. You just go to the ER." And that's the truth. Just go to the ER. Who comes to the emergency room? Well, it turns out that it's women and old people. Women and old people. If you haven't been to the emergency room yet, your day is coming up. Everybody will come to the emergency room eventually. But right now it's mostly women and old people. Not men. Why not men? Because men deny illness. And this is one thing they all do, including me. I'm not a hypocrite. Sir, why didn't you come to the emergency room? You have this tumor growing on your chest, and it's now eating through your ribs into your lung. How long has that been there? Oh, it's been there about a year, I reckon. Did you do anything? Well, we put aloe on it, and I put some salve on there, and we let the dog lick it, and it just seemed to get worse and worse. And yes, sir, it's actually eating through your entire body. Well, Nadine said to come in, but I just figured, you know, it'd get better and go away. Well, it didn't. So men will only come to the emergency room for 2 reasons. And I tell the patients when I see them, if you can guess the 2 reasons or one of the 2, I will give you a discount in your ER visit. So I'll give you the first reason. The first reason is if there's something in their eye. If they have something in their eye and it's painful, they will come to the emergency room eventually. If they're drunk or under the influence of drugs, they may not come that day, but they'll be there within a day with something in their eye. The other reason is something wrong with something personal. And no, it's not VD, it's not sores, it's not festering sores or discharge of the penis that will bring them in. It's the fact they can't pee. If a man can't pee, he will come to the emergency room. Otherwise, it's the wife who brings them in. It's the wife who brings them in. She tells them, you need to come, you've got to come. Men and women are a lot different in the way they approach their health. Let's talk about bowels, for example. Men, even though they look at, when they go number 2, they look at it every single time. They'll even take the smeared specimen and look at that every single time. But why they look, I don't know, because they do absolutely nothing about it. There's blood in there. There's something moving in there. God, I hope it gets better. Women go to the bathroom and they're like cats. I've been married for 37 years. I've never seen her go. She's in there, she's out of there. I know she goes a lot because there's a lot of toilet paper being used around there, but for some reason or another, I never see it. So men and women are completely different. Men deny everything. They can have chest pain, vomit blood, pass out, get paralyzed on one side. They will not come to the emergency room unless their wife or girlfriend makes them. So that's just the way it is.